Warning: 12 weird signs that show you're having low sperm count. Low sperm counts are stealthily reaching epidemic proportions, robbing men of their prime vitality and standing between couples and the baby they long for. But before you resign yourself to low testosterone and infertility, know that simple, science-backed lifestyle measures can coax your body to replenish healthy sperm. You hold more power than you realize. In today's video, we'll be going over 12 peculiar and often overlooked signs that may signal a low sperm count. Catching a low sperm count early is key, as it's a leading cause of male infertility. But the condition is sneaky, rarely causing obvious symptoms until it is advanced. Stay tuned as I reveal the subtle clues your body may be dropping about dwindling sperm numbers. Plus, we'll share 6 lifestyle tweaks to help safeguard and replenish your sperm, boosting fertility naturally. Let's dive in. Difficulty conceiving. The number one warning sign of a low sperm count is struggling to get pregnant after having frequent, well-timed intercourse for over 12 months. With each attempt failing despite normal fertility evaluations in your partner, a low sperm count becomes the likely impediment. Healthy couples have an approximately 20 to 25% chance of pregnancy each cycle, which drops incrementally as sperm count declines. Mild oligospermia leads to longer time frames, while severe oligospermia often precludes natural conception altogether. If your partner is under 35 with confirmed ovulation, yet pregnancy remains elusive after a year of diligent trying, get a semen analysis to quantify sperm concentration. Changes in ejaculate volume or color. Have you noticed your semen volumes becoming smaller, almost negligible, with ejaculations that are thin and watery rather than thick and milky? This declining semen quality reflects diminishing sperm numbers and viability. Normal, healthy semen appears grayish-white and gel-like, coagulating upon release. As sperm production decreases substantially, ejaculate becomes almost clear and very scant, barely a teaspoon, making conception impossible. The watery fluid lacks the viscous, sperm-rich components vital for carrying sperm through the female reproductive tract. Even color changes to yellowish or reddish may indicate issues. Closely track ejaculation changes, which signal oligospermia. Less dense, hair growth. Patchier body hair, including diminished beard density or flaky leg and arm hair, signals lower androgen levels tied to decreasing sperm counts. The same mechanism impairing sperm development in the testes also disrupts hair growth mediated by these masculinizing hormones. Your genetic hair pattern will still prevail, but with inadequate density, length, and texture. Areas like the chest or abdomen may lack typical hair distribution. Eyebrows also thin out. Without sufficient testosterone and related hormones that govern sperm production, hair follicles weaken, unable to maintain manly hair growth. Genital hair remains but appears more sparse. Reduced testicle size. A noticeable decline in your testicle size on one or both sides can result from shrinking sperm production, reflecting impaired testicular function. Carefully notice any changes in the size, shape, texture, and hang of your testicles, which normally atrophy slightly with age. But more severe diminishing, softening to a flaccid consistency, and loose droop indicate worse atrophy from depleted sperm formation. Firmer, larger testes support robust spermatogenesis. Your doctor will confirm significantly smaller or irregular testicles upon examination. This shrinking testicular tissue leads to lower intratesticular testosterone, which is crucial for sperm development. Low libido and erection problems. Gradual loss of interest in sex, difficulty achieving erections, and poor rigidity or early deflation when aroused can signal testosterone decline, accompanying oligospermia. Sex drive relies on testosterone stimulation in the brain, which wanes as sperm counts drop. Erections require testosterone-induced vascular flow, becoming unresponsive without ample hormones. Sexual stamina also diminishes rapidly. These symptoms often develop subtly and are not traced to low sperm until fertility loss or overt sexual dysfunction arises. But catching early warning signs allows for earlier intervention to mitigate testicular damage and neurological vascular sexual issues. Breast tissue growth. Some men with severe low sperm counts experience growth of glandular breast tissue, causing pain or tenderness behind the nipples, along with mild cosmetic enlargement. Known as gynecomastia, this enlarging of male breasts results from the hormonal imbalance of very low testosterone coupled with relative estrogen dominance. Early gynecomastia emerges as puffy or dimpled areolas and a small rubbery disc of tissue directly behind the nipples that may be visually noticeable through shirts. In modest cases, only distinct lumpiness is felt underneath or around nipples. But substantial breast enlargement can develop with high estrogen and ultra-low testosterone. Fatigue. Feeling constantly tired, sluggish, and low energy may signal anemia from occult testicular bleeding in some men with low sperm counts, particularly varicoceles. Repeated minor hemorrhages drain bodily iron stores, needed to produce hemoglobin and red blood cells carrying oxygen. Testosterone decline seen in oligospermia exacerbates exhaustion. Also, medical issues like hypothyroidism related to infertility sap energy. Before true fatigue sets in, notice if your baseline vitality seems somehow lessened. Are you lacking motivation for once pleasurable activities? Is exercise capacity reduced? Pay attention to any unexplained energy shortfalls. Mood instability. The mind often suffers along with the seed. Brain fog, anxiety, sadness, irritability, and negativity frequently accompany a low sperm count, resulting from its hormonal effects on mood and emotions. Losing your libido also dampens confidence. Monitor your mental state for signs of instability or turmoil and utilize stress management techniques. Seek treatment early, as cognitive and emotional issues worsen in parallel with declining sperm counts if the root hormonal imbalance goes unaddressed. Ultimately, low sperm production can profoundly impact quality of life and relationships if left unmitigated. Tackle both physical and mental fertility health together. Weight gain and gynoid obesity. Low testosterone with oligospermia can manifest as excess weight and loss of muscle tone, particularly feminine pattern fat deposition, adding weight to hips, thighs, and buttocks, along with a protruding belly. Despite your fitness efforts, this aberrant flab distribution accumulates and feminizes your physique. Plus, mood issues sabotage motivation for diet and exercise adherence. If a beer belly phenotype emerges contrary to your genetics or you develop man boobs, evaluate whether poor testicular function might be stealthily driving these changes. Identifying hypogonadism early prevents worse metabolic issues. Disturbances in smell or taste. Smell and taste depend intimately on reproductive biology, so impaired senses are occasionally associated with severe sperm deficits. Smell dysfunction stems from disordered nasal chemoreceptors, which utilize primordial gonadotropin hormone pathways shared with sperm production. Similarly, taste receptors and zinc status influence taste perception, which requires zinc and other nutrients critical for spermatogenesis. You may notice odd phantom smells, sensitivity to once agreeable foods, or peculiar cravings. Though not everyone with low sperm experiences sensory issues, the sudden onset of smell or taste irregularities warrants sperm testing. Hot flashes. Some severely testosterone deficient men exhibit menopause-like hot flashes totally unrelated to infection, hormonal swings, drugs, or anxiety. Sudden sensations of flushing, sweating, and skin warmth strike sporadically due to dysregulated temperature control. Night sweats with oligospermia also disrupt sleep. While classically considered female, hot flashes in fact arise from abrupt hormone changes. Pituitary signals gone awry in some men mimic withdrawals during female menopause. If you develop new-onset flushing and warmth episodes approaching midlife, evaluate testosterone along with sperm counts, as they often plummet together. Cognitive fuzziness. Low sperm count can directly cloud thinking through mutated genes, and testosterone deficiency impacts brain function. Symptoms include mental slowness, forgetfulness, difficulty focusing, and an inability to complete complex cognitive tasks either professionally or personally. Physical factors like chronic inflammation and nutritional deficiencies also contribute to this brain fog. Moreover, grieving fertility loss often exacerbates concentration issues. Seek medical attention early when cognition seems off, as later-stage oligospermia worsens organ damage along with mental functioning. Don't write off worsening fuzzy thinking as just stress. Determine whether a physiological cause needs correcting. 6 ways to naturally boost sperm count and fertility. Low sperm count often stems from lifestyle factors and reversible health conditions. Before rushing to fertility treatments, try improving sperm parameters naturally through frequent ejaculation. According to popular belief, ejaculating daily does not sap sperm reserves. In fact, regular releases preserve sperm quality and enhance production. So dispel any notion that you should limit sex to your partner's fertile window. For optimal sperm nourishment, aim for climax, ideally every 2 to 3 days year-round. This consistent clearing of aging sperm maintains fresher, higher-performing sperm. As an added bonus, daily orgasms dilute toxic compounds like BPA and phthalates we encounter environmentally. Do take 1 week of ejaculation breaks monthly and avoid prolonged abstinence of over 2 weeks, which can mess with sperm maturation. Exercise and weight control. A sedentary lifestyle, obesity, and excessive testicular heat are all death sentences for healthy sperm production. Make it a daily habit to exercise moderately for at least 30 minutes. Maintain an active lifestyle that keeps your testes naturally cooler. Added weight compounds the problem, specifically excess abdominal fat, which metabolically disturbs hormones. Implement a smart fat loss plan focusing on diet quality and strength training. Ditch restrictive fad diets. And watch out for snug underwear, laptops directly on the lap, prolonged hot showering, hot tub soaking, and heated car seats that overheat the testes. Quit smoking and limit alcohol. Smoking is disastrous for sperm health and DNA integrity, nearly doubling abnormalities while decimating counts. Carcinogens and heat stress destroy sperm. Similarly, excess alcohol inflames testicular tissues and impairs sperm maturation. If needed, get active support to successfully quit smoking through counseling or medication. Your fertility depends on it. Also, restrict alcohol intake to 1 to 2 light drinks, no more than 3 times a week. Binge drinking is strictly off limits, along with recreational drugs. Create an environment optimized for sperm development by limiting harmful exposures. Reduce stress and sleep well. Stress hormones like cortisol and catecholamines, while acutely protective, chronically disrupt the delicate hormonal dance between the brain and testes that governs optimal sperm development. Unmanaged stress also encourages unhealthy coping habits that depress sperm count. Adopt regular calming practices like yoga, mindfulness, and meditation to lower stress hormone levels. Prioritize 7 to 9 hours of quality sleep nightly because testosterone production peaks during REM sleep, which sperm need. Set bedtime habits, limit devices before bed, sleep in total darkness, and maintain cool room temperatures. Take supplements. Specific compounds like zinc, vitamin D, selenium, and L-arginine have been scientifically shown to boost sperm parameters when deficient. However, more is not necessarily better. Megadosing supplements without a confirmed need often backfires. Have your levels tested and take a physician-recommended fertility-supporting multi with science-backed ingredients to offset nutritional gaps. Targeted selenium, vitamin E, vitamin C, and CoQ10 offset oxidative sperm damage in some men. If clinically advised, correct individual deficiencies with the appropriate supplement while avoiding reckless oversupplementing. See a reproductive urologist. Get a thorough fertility evaluation to uncover any reversible medical issues or undiagnosed conditions impairing sperm formation and hormonal function. Varicoceles, infections, medications, toxins, diabetes, trauma, undescended testes, or obstructions can potentially be treated and resolved. Identify correctable causes early, before cumulative damage progresses. See a reproductive urologist with specialized expertise in male fertility investigations. They can order hormonal blood panels, genetic tests, ultrasounds, and semen analyses to pinpoint the sperm-sabotaging culprit for personalized treatment. Pay attention to subtle warning signs rather than waiting until complete infertility sets in. Early intervention yields the best outcomes. Conclusion. In review, prolonged fertility struggles, shrinking testicles, gynecomastia, low libido, or feminizing body changes could reflect an insidious low sperm count or oligospermia. Don't ignore these subtle hints. See a doctor to test sperm and hormones. With lifestyle tweaks and the right medical care, robust sperm regeneration is often achievable, along with restored virility and fertility. Please like and subscribe if you found this video helpful. Wishing you excellent health and fertility ahead. Together, we are winning health.